All right, welcome to Chapter 4, Introduction to Medical Terminology, Human Anatomy, and Lifespan and Development. So when we're talking about medical terminology, there's two categories. One is the descriptive, which describes shape, size, color, and function. The other category of medical terms is eponyms. So that is something where something is named after someone that invented it, whether it's a medical procedure or someone discovered a disease and it's named after them, things like that. There's three parts to a medical word. There's the root, the prefix, and the suffix. And if you look at tables 4.1, 4.2, and 4.3 in your textbook, it'll give you a breakdown of different root words and the prefixes and suffixes. So let's think about it. Why is it important to learn medical terminology for an EMR? Well, let's say you have a patient with a history of endocarditis. Endo means within, card means heart, and itis is always inflammation. So you're able to break down that word and figure out what it is. So if a patient tells you, oh, I have endocarditis, you can be like, oh, well, that's inflammation of the heart, in the heart. Cholecystectomy. So chole means like gall, cyst means like bladder or cyst, and an ectomy is a surgical removal. So you have a surgical removal of the gallbladder there. So if the patient doesn't quite understand what it is they have, if you have a basic understanding of medical terminology, you can kind of, figure out what's going on with their medical history. So positional and directional terms. So anatomy is the study of the structure, so how things are built, basically. Anatomical position is the standard reference point or reference position for the body. So it'd be like if you were standing up straight, facing forward, palms forward, that is considered anatomical position. So when someone is in anatomical position, this is when we are describing our right and left. So just remember that whenever we're talking about right and left in this class or any other EMS training, we are referring to the right and left of the patient, not our right and left. Here's a figure from the book where it shows how the body is divided into different areas. You have your anterior, which is the front of the body or body part. So that'd be like, your face is anterior. Your posterior would be the back of your body. So your spine is in the posterior portion of your body. The midline is like an imaginary vertical line used to divide the body into right and left halves. So it goes straight down through your nose all the way down, and then anything that is said to be medial is close to that line, is more towards the center of the body. Anything lateral would be away from that. Anything superior would be up towards your head, inferior towards your feet. Anything proximal would be closer to the torso. So for example, your bicep would be proximal to your elbow because it's closer to the torso than your elbow is. And then opposite to that, anything distal would be farther away from the torso. So your wrist would be distal to the elbow. So it's further away from the trunk than your elbow is. Supine would be lying face up on your back. Prone, lying face down. And then you have your recovery position, which is also called the lateral recumbent position. And that's when you're lying on your side. Now, in EMS, for the most part, this is going to be on the patient's left side. Then we have semi-Fowler's position, where the patient's sitting up and at an angle. So their legs are out straight like on the gurney, but their back is kind of tilted upward. Trendelenburg is when they're laying flat on their back, but their feet are elevated to help treat low blood pressure. And then you have the shock position, which is the patient lying supine, so they're flat on their back, their feet are elevated, and legs bent at the hips. So here's a picture depicting a guy that is in the supine position. So he's on his back face up. This individual is in the prone position, so lying face down. And this lady here, she is in the left lateral recumbent position or the recovery position. And you notice that she is on her left side. Part of the reason that we typically use the left side is, especially with pregnant females, when they are flat on their back, the baby tends to pinch off the blood flow that's returning to the heart. So by laying them on their left side, it kind of takes the weight off that vessel, the vena cava, that's taking blood back to the heart, and helps them recover better. This position also allows for any secretions in the mouth to drain by gravity, so they're not draining into the back of their throat. This is the semi-Fowler's position. You can see how his legs are out straight. His back is tilted, but not straight up. And this is Trendelenburg. You can see that his feet are elevated, and the gurneys, they should have a mechanism that locks it in that position. And this is the shock position. So this is the difference between Trendelenburg and shock position. So their feet are elevated, however, they're bent at the hips and the knees. One way to do this, obviously you can't put a chair on the gurney, but you may use, a bunch of pillows, blankets, maybe your jump kit, anything that you might have that if you need to put them in this position. All right, so we mentioned anatomy earlier being like how things are built in the body. Now, physiology is basically the way things work. Our body's divided into different regions, and there's 4 major body cavities. So your cranial cavity, thoracic cavity, abdominal cavity, and pelvic cavities. Here's a good picture that depicts each cavity. You have your cranial, thoracic, abdominal, and pelvic. So in your cranial cavity, you've got your brain and its specialized membranes. So not much in there, but it is probably one of the most important things we have. In your thoracic cavity, you have it protected by the rib cage, and that's protecting your lungs, heart, great blood vessels like your vena cava and your aorta, part of your windpipe and part of the esophagus, and also the diaphragm. And the diaphragm is also our primary muscle for breathing, and it also divides the thoracic cavity from the abdominal cavity. So this picture is great other than one thing. So for whatever reason, it depicts the stomach as well, but that is actually in the abdominal cavity, but everything else you see here is in the thoracic cavity. So just remember that the stomach is down in the abdominal cavity. So this lies between the chest cavity and the pelvic cavity, your abdomen. It's got your stomach, your liver, your gallbladder, your pancreas, your spleen, small intestines, and then most of your large intestines. The pelvic cavity is protected by your pelvis, and it's got your urinary bladder, just parts of the large intestine, and then your internal reproductive organs. Your abdominal, man, I'm having a hard time saying that, abdominal quadrants. So remember, this is the patient's right and left. So they have the right upper, which is where you're going to see your liver, your gallbladder, and part of your small and large intestines. Now, whenever you're taking an EMR test or an EMS test of any kind, if the test question is describing something to do in the right upper quadrant, you want to look for liver or gallbladder in the answer. And then in your left upper quadrant, you have your stomach, spleen, pancreas, part of your small and large intestines, and part of the liver. Now, in the left upper quadrant, if you see a test question on that, you want to think stomach, spleen, or pancreas. In your right lower is going to be your appendix and part of your large intestines. But if you have any test question that describes pain in the right lower, the odds are your answer has to do with the appendix. And then down in your lower left quadrant, you have your small and large intestines. Here's a good figure depicting what's in each cavity. They go into pretty good detail here, but if you just remember what I mentioned on the previous slide, that's what I would worry about most if I was you. Here's a great picture depicting your solid organs versus your hollow organs. So you have your spleen, liver, pancreas, and kidneys. Those are your solid organs. Hollow organs are your stomach, your gallbladder, your large intestine, small intestine, and bladder. So how might knowing what's in each body cavity and where your organs are might how will that help us in when we're assessing the patient? Well, for example, with a stab wound, if we have a patient that's been stabbed in the right upper quadrant, there's a good chance that their liver's been lacerated. Abdominal pain, if we know what's in each quadrant, and they can say, oh, my pain's right here in my right lower quadrant, we can then say, well, have you ever had your appendix out? Or we can go down that path. So that's why it's important that we know this. Body systems. So the body has multiple systems that operate together to maintain homeostasis, which is normal function. We've got a respiratory system, which consists of your upper airway, which is just your nose, your mouth, and your larynx. And your pharynx is just an opening, a cavity. So that's just the space behind your nose and mouth as your nasopharynx. The lower airway consists of the trachea, which is your windpipe, your lungs, your bronchi, bronchioles, alveoli, and associated muscles. So air flows in through your naso and oropharynx, or your nose and mouth, goes down your trachea, into your lungs. Oh, excuse me, that's out of order. Goes down your trachea, into your bronchi, into your bronchioles, and into your alveoli, where gas exchange takes place. And that is where that's all located in the lungs. And then you have your associated muscles, the main one being your diaphragm. The functions of the respiratory system are exchange of oxygen and carbon dioxide. It warms, filters, and moisturizes the air, and then hopefully prevents us from aspirating, which is getting fluid in the lungs. There can be complications with the respiratory system, so perfusion can adversely affect or can be adversely affected if the patient's not breathing adequately or stops breathing. And there's a lot of diseases and injury that can disrupt flow of oxygen, like COPD, asthma, and other things like that. The cardiovascular system works hand in hand with the respiratory system. It contains the heart, the blood vessels, and the blood. There's two sides. You have arteries that carry oxygenated blood to the body, and veins carry blood back to the heart and lungs. Now, one thing that I think is really important to mention and for you guys to know is that it is a common misconception that all arteries have oxygenated blood and all veins have unoxygenated blood. That is true 90% of the time, but in pulmonary perfusion and fetal perfusion, so it's opposite. And we'll talk about that a little bit more later. But anyways, what you need to remember is arteries take blood away from the heart and veins take blood to the heart. So if the artery is in the name, that means the blood is going away from the heart to the body. And if there's a vein in the name, then it's going towards the heart. So the functions of the circulatory system are to carry blood and other nutrients to the body cells, and they get rid of the waste and the carbon dioxide from the cells. Dysfunction of it can lead to poor perfusion and buildup of waste. So the musculoskeletal system. So this is your muscles and bones. Primary structures, in addition to your bones and muscles, are your tendons and ligaments. So its functions, they obviously give us structure, support, help us with movement, protect our internal organs. And the skeletal system also produces our white blood cells, which help us fight infection. The musculoskeletal system is divided into two different skeletons, your axial skeleton, which is your skull, vertebrae, ribcage, and sternum, and then your appendicular skeleton, which is your upper lower extremities, and then your shoulders and your pelvic girdles. About 40 to 50% of our body weight is muscle, probably more so for some people than others. Our nervous system is basically our supercomputer that runs everything. It's made up of the brain, spinal cord, and nerves. Its functions, obviously, it controls everything. It controls movement, interprets sensation, regulates our body activities, and generates memory and thought. So the central nervous system, it's divided into two nervous systems, central and peripheral. Central is your brain and spinal cord. That's the computer. Peripheral is your sensory, so anything incoming, and motor is outgoing. Autonomic nervous system, which is part of the peripheral, is just things that happen automatically, like your heartbeat, respirations, things like that. And it has a sympathetic and parasympathetic side. Here's a image of our spinal vertebrae. There are sometimes test questions on how many of each vertebrae there are. They may ask you how many thoracic you have, or how many cervical. The easiest way that I've been able to remember that is, and it's kind of silly, but if you remember that you have breakfast at 7 a.m., you have lunch at 12, and then you have dinner at 5, and just remember that there's two fives because your lumbar and sacrum both have 5 vertebrae. And then your coccyx is usually 4. So from the top again, it's breakfast at 7, lunch at 12, dinner at 5 twice, and then a snack at 4 a.m. And you should be able to, rule out any wrong answers on a test question if you remember that. Another body system we have is our digestive system. That is the esophagus, our stomach, liver, pancreas, and our small and large intestines. It breaks down food, turns it into energy for us, and then gets rid of the waste. Our reproductive system, for males, it's the testes and penis, and female, it's ovaries, fallopian tubes, uterus, and vagina. Its functions are hormone production, so not just to reproduce, but it does do a lot of hormone production, and then gestation and development. Then our urinary system, it has our kidneys, ureters, bladder, and urethra, and that's the order that the fluid goes through. So it goes through the kidneys where it's filtered out. From the kidneys, it travels through the ureters, which is like hoses that go to the bladder, and then from the bladder, it's excreted out through the urethra. Its functions, like we mentioned earlier, is to remove chemical waste and help balance water and salt levels in our blood. And the integumentary system. So that's our skin, nails, hair, sweat glands, oil glands, and mammary glands. So our skin, just remember this, if you ever see a test question that asks you what is the largest organ of the body, it's actually our skin. There's 3 layers, your epidermis, which is epi means around, and dermis means skin, so that's around the skin, so that's your outer protective layer, your dermis, which is the middle layer, and then the subcutaneous layer, sub meaning below. So it also houses all of the other structures of the integumentary system. So the skin, being the largest organ in the body, like I mentioned, it protects us from the outside environment, helps us regulate our temperature, it helps us sense hot and cold, as well as pain and pressure, and it helps us regulate body fluids and chemical balance. Here's a breakdown of the skin layers. Obviously, and they make it seem pretty thick here, but it is actually super thin. But even down microscopically, the epidermis is a very thin layer. The dermis is thicker than the other two. And then you have the subcutaneous layer. Our endocrine system, endo meaning within. So its structures involve the thyroid, pituitary, your adrenal glands, and your pancreas and your gonads. Adrenal is where our epinephrine is produced, or adrenaline, and then pancreas is where our insulin is produced, which helps us with the sugars in our blood. It regulates our metabolism. It's what determines our physical size and strength, hair growth, voice pitch, and reproduction. Lifespan and development. So the biological is our physical body, cognitive is our mind, and psychosocial is how we interact with our surroundings. So here's a list of the different stages of life, all the way up to end of life. So let's go into more detail here. So neonates, that's birth, from birth up to 1 year. So they're sensitive to cold temperatures. meaning they don't tolerate cold very well. Separation anxiety and visual assessments are their most productive for us as EMTs or EMRs. So what we see, because obviously they can't talk to us, tell us what's going on. Toddlers, that's your 1 to 3 year olds. They have a sense of independence. They have stranger anxiety and separation anxiety. Preschoolers, 4 to 5 years old, they have concrete thinking skills, so they're starting to work things out on their own. They need reassurance. They respond well to simple explanations. They also get anxious when they're separated from mom and dad. So when you're assessing them, this says start with the extremities, then the trunk, and then the head. However, I would think it'd be better to say to start with the uninjured area and progress towards the injured area, because if their injury is the extremity and you go and you touch that first and it hurts them, then you're probably not going to get to assess them any further. So I think it's better to say, start with the uninjured area and assess towards the injury. These kids are also typically quite modest. They want to get dressed up and wear their nice clothes. School-age children, 6 to 12 years old, so they've got a basic understanding of their body and its functions. They can communicate more complex ideas with you. They take what is said very literally, and they're aware and afraid of death and dying, as well as pain, deformity, blood, and permanent injury. So they're a little bit more stressed out on calls. Then you've got your adolescents, 13 to 17-year-old. They understand anatomy and physiology. They can process and express, complex ideas. They're definitely risk takers. They don't really think about the consequences, however. So traumatic injury is a big one with them. They are afraid of disfigurement and permanent injury. They definitely believe they're immortal and indestructible. And even though they think like they act like it, they want to be treated as adults. Then early adulthood, 18 to 40. This is where we're at the peak of our health. We're very active, or we should be. I should probably be a lot more active than I am. Make up a large number of those involved in traumatic injuries and accidents. I believe that is the leading cause of that age group's death, is traumatic injury. Middle adulthood, 40 to 60 years old. Decrease in ability to see and hear well. You might shrink a little height-wise. Hair begins to turn gray or fall out. And you start to get permanent wrinkles. And finally, we move on to late adulthood, which is 60 years old to the end of life. Your hearing, taste, and smell continues to deteriorate. It gets harder for some people to get around. You'll see a lot of canes, walkers, wheelchairs, things like that. They may be more aware of their own mortality. They may not be able to perceive pain as well as us, as younger generations. And they often have multiple illnesses and take a lot of different medications. So that is the end of chapter 4. I hope you've enjoyed this presentation, and hopefully this works out for us. If you have any questions, please feel free to text me, email me, or give me a call.